Good afternoon. Can you all hear me? No, not yet. Oh, now you can hear me. My name is Dr. Crystal Harris, and I'm the Associate Dean of the School of Nursing and Health Professions. Welcome to this special afternoon. Thank goodness the weather cooperated with us at least a little bit today. On behalf of the nursing faculty at Missouri Western State University and our administration, I want to welcome you to the White Coat Ceremony for Nursing, and I really do appreciate your attendance. We are also live streaming for the first time, so I would also like to welcome our guests that are watching us as well. Before we continue, I'd like to recognize a few of our members of the Missouri Western administration whose support has meant so much to us. We have Dr. Doug Davenport, who is our interim Provost and Vice President for Academic Affairs. We also have Dr. Ben Caldwell in attendance, who is the Dean of the College of Professional Studies and the School of Graduate Studies. Thank you for your support. And you'll also notice we have some faculty sitting in this area, and they're very important to the education of our nursing students. And you can see their names, I think, are on the back of your program, and make sure that you talk to them after this event, because I know they'd be excited to talk to you as well. So tonight we are going to formally welcome the BSN class of December 2020 to the clinical practice of nursing by cloaking them in their white coats. So this is a very exciting event. First off, doesn't it sound good to hear the class of December 2020? They're all shaking their heads. Yes. Let's give them a round of applause just to start out. So what we're doing this evening is we're going to be cloaking them with white coats, and this is a timeless symbol of care and compassion in healthcare. So white coat ceremonies have been around in other health-related professions and disciplines for some time. However, in 2014, the nursing programs across the country, with initial funding from the Arnold P. Gold Foundation and the American Association of Colleges of Nursing, began a new tradition. The white coat ceremony is intended to signify the beginning of clinical immersion, and it's to symbolize a commitment to excellence and holistic patient-centered care. That means we're focusing in on the patients. They're the most important thing. This evening is all about you, though. We're focusing on our graduating class of 2020, you, the student nurses. And we want to focus on the choices that you're going to make to become excellent nurses. As we remember those who have gone before us, we also look to the future, and you are our future. You are the future. How's that make you feel? Okay, or are you kind of feeling the weight a little bit? So you're going to be going out into the clinical world and caring for your first patients as nursing students, applying the knowledge and skills that you've already started gaining through the program, through the first nursing courses and lab experiences, and maybe even those that you've learned in assessment class while practicing. You're going to get to put all those things to work here pretty soon. And, you know, I've said this before, but in all my years as a nursing faculty, you know, I never get tired of seeing the excitement. You know, as you start your first semester and you're beginning, you're getting to know who your professors are, you're getting to know the people in your class who are going to be your best friends, because anytime you're doing assessments on them, you tend to get a little closer really fast, and you're interviewing them, so you get to know them as people, and they're going to be some of your greatest support systems. So, you know, that's an important thing, and I love to see, you know, that camaraderie building. I also love to see that excitement as you get ready to go out on your first experiences, those first things that you're going to be doing. I love to see it when you're sitting in the hallway getting ready for your first checkoff. and you've got your notes list, and you're all going through it, and you're practicing back and forth with your partner, and you're talking through things, and the excitement is building. So you've got that first sim lab experience. You've got your first exams and the discussions that happened afterwards, and talking about whether the questions were right and whether you got them right, or whether your instructor was just wrong, or yeah, we know that that happens. Or the first time you're taking vital signs and actually get the blood pressure right, that's always an exciting thing. The first time that you give an injection, as nurses, sometimes we're in community places and we may be paying attention to people's hands to see what kind of veins they have and whether we could start an IV on that. So you start taking all those things in. But I will tell you the first that I'm most excited about, and that's, you know, the thing that I think touches me the most is the first time when students acknowledge that it was, I'm their nurse, and they got to know people as an individual, and they knew about the person's life that they were taking care of, that person as an individual, not just by what was wrong with them. I think that's a critical time when you start transitioning to real nursing, is when you start acknowledging that whole person and everything that they bring to the table. So Florence Nightingale once said, nursing, I couldn't not come up here and mention Florence because, you know, she is just one of our shining lights in our profession, and so we have to mention her. But she said, nursing requires an exclusive devotion, as hard a preparation as any painter or sculptor's work. That means we have to work just as hard as those people that are creating those wonderful pieces of art. But then she said, you know, but we have to even work harder because we're working on a living person, a living body. So your preparation is going to be challenging, and there's going to be quite a few firsts in that. You're going to finish your education at Missouri Western and be walking across the stage in a pinning ceremony before you know it. And then you're going to be entering into that time-honored and sacred art of nursing. And what I ask is that you embrace your first, and prepare and devote yourself to excellence. Devote yourself to that special art, the most special art that we call nursing. Now I would like to invite Dr. Heather Kendall to the stage, and she's going to take over here.
All right, thank you, Dr. Harris. Okay, well, first of all, I want to say that we have a small change in our itinerary. Our guest speaker unfortunately slipped on the ice today and hurt her ankle and was not able to walk well enough to be here. And she sends her deepest apologies. She feels terrible about not being able to be here. But instead of that, what we are going to do is a few of the nursing faculty are going to talk to you about what our path was to getting to where we love, okay? I am a critical care nurse, and I didn't know when I was in your place that I was a critical care nurse. I found out I needed to be a critical care nurse when I was a senior, actually. So I went into my critical care rotation not really knowing what the ICU was or what it was all about. And when I walked into that place, it was like, these are my people. Like, I just met my people. And so I wanted to share with you a little bit about why I love critical care nursing and what brought me to it, and then I have a little story to tell too. So the reason that I love being a critical care nurse is because I love puzzles. I always loved puzzles when I was a kid. I liked math. I liked to figure out how things worked. sometimes even animals. I wanted to figure out how they worked and things. I wanted to figure out how their bodies worked. I wanted to figure out how organs worked. I was always reading through about anatomy and physiology and things like that. And I think that's one of the things that really draws me to critical care nursing, because it always drives me to think, to try to figure out that puzzle, to try to find the answer, to figure out what's wrong. So the story that I want to tell you is actually the story that Bria was going to tell you. So there are things that you learn in nursing that we use every day at the bedside. And one thing that you all have already learned is how to save someone's life with CPR, right? You've already learned that. I have performed CPR on countless patients during my time working at the hospital as a critical care nurse. Only one time have I ever done CPR outside of the hospital. And that's where the story begins. So it was a while back on just a random weekend day in July. Myself, my husband, and my daughter, we decided on a whim to go to the Mustangs game at Phil Welch Stadium. And they were having Christmas in July that night. Like the Frozen characters were there. They had this little thing. Olaf was out on the field. But somewhere, I don't know, several innings into the game, I heard a loud gasp from some of the people sitting over to my right, and you know, everyone does this. You naturally look that direction, and I hear some people whisper, "Oh, she fell." I thought, oh, somebody fell. They'll get up, right? And then I hear this voice. I hear this voice that says, "Help, somebody call 911. And I thought, okay, maybe I should go see what's going on here. And I get over there and I see a woman laying on the bleachers, and another person is tending to her. And I go up and I tap this person on the shoulder and I say, you know, what we all want to say, "I'm a nurse, can I help?" And the person that turned around was one of my old ICU coworkers. And I said, "Oh, hi." And she said she fell. Okay, well, let's get her turned over. And so we turn her over and quickly realized that this young woman is not breathing and does not have a pulse. And her young family is there with her, a couple of kids and her husband. And so I quickly look at her husband, ask him what happens, and he says, I don't know, she just stood up and then she fell. She had a baby about 3 weeks ago, he says. Oh, okay. I'm no OB nurse. I sure hope it has nothing to do with that. So we quickly realized that this woman doesn't have a pulse and she's not breathing. And so my friend that I used to work with in the ICU starts doing chest compressions on her because that's what we've been trained to do. And what comes next after chest compressions? The breaths, right? I was at her head. So we coordinated together. She gave chest compressions, and I gave this young mother mouth-to-mouth. Serendipitously, there happened to be an AED in the park that actually didn't belong to the park itself. It was an attendee, a child actually, who had a heart condition, and his mother brought his AED. And so we used it on her. So an AED, for those of you that don't know, it's an automated defibrillator. And so we shocked her heart. We did CPR on her. Eventually, the paramedics arrived. But by the time they arrived, she was already starting to wake up for us and had a pulse. So she went to the hospital and she got care because she had had a pretty severe heart attack, even as a young woman. Okay, and this was probably some sort of a congenital issue that she was born with that just presented itself at that time. I share this story with you because you never know where you're going to need to use those skills that you learn. We all think about going to our jobs and being nurses, but what I want you to understand is that being a nurse is not a job. It is who you are. It's not just what you do, it's who you are. And those skills that you are learning every day, you might use anywhere. So don't limit those to the location that you happen to be. That's my message to you. So I'm going to invite Dana McDaniel to come up, and she is going to share her message.
Okay, my name is Dana McDaniel, and I teach in the 4th semester, so I'm sure that you guys all think it's a long way away, but it'll be here before you guys know it. So I teach the leadership course, and then I teach acute capstone, so I will see you guys in not too far away. In addition to my role as a nurse educator at Missouri Western, I've been a nurse practitioner in oncology for the past 13 years. But when I was in your guys' position, I had no idea what I wanted to do until kind of like Heather, my senior year in nursing, so my 4th semester in nursing school, I thought that I wanted to be a cardiology nurse. I was assured that that's what I was going to do. I was enthusiastic about it. But unlike you all, you guys probably have jobs that are going to be just out there waiting for you. It wasn't like that when I graduated. The jobs were few and far between. And so I applied, and there were no cardiology nursing jobs available. So they said, well, you could have the float pool or you can have oncology. Neither one of them was I enthused about. However, I thought, well, let's give this oncology thing a try. So fast forward 19 years, I'm still in oncology. So I wanted to kind of let you guys know that your heart might be set on something, but you never know where your path is going to take you. So just kind of let it be that way and just let it be directed for you. Let's see. For those of you that aren't familiar with the word oncology, it's just a fancy word for the study of cancer. And cancer is a word that I'm sure all of us would probably we would be okay if we never had to hear that word again. And I can speak firsthand about that statement. And I wanted to tell you guys about a patient of mine that he was near and dear to my heart. It was my dad. And in 2012, my mom was in the hospital. She had had a total knee replacement, and she was resting in the bed. So my dad said, he said, sis, that's what he called me, will you come in here and check this area out in my leg? And so I said, sure. So I went in there, and we had to do it discreetly because he didn't want my mom to worry. Apparently, he didn't care if I worried, but he didn't want my mom to worry. So I went in there, and in his medial aspect of his right thigh, he had a firm area that was about the size of a quarter. And with my oncology experience, I knew right away that it was malignant, that it was cancer. And so he ended up being diagnosed with a fibrosarcoma, and had a very poor prognosis. In the very beginning, we knew that. And before I knew it, my dad ended up becoming a patient of ours at the cancer center that I worked at. So that was a real big challenge. And being a nurse and having your father as one of your patients, not an easy thing to do. So as I watched my dad and my family have to endure that roller coaster, a horrendous roller coaster ride, that was something that was very difficult. But my skills came into good use. I was able to provide care for my dad. I could give him medications at home. I could help him with dressing changes. I could help my mom understand what was happening and going on with my dad. Sometimes I knew a little too much, and I didn't really know how to deal with that. But I was also able to give him some emotional support, which he very much needed. At the end of his life, I was able to provide him medications to take care of the air hunger that he experienced and the pain that he experienced, so he didn't have to experience that. And he wanted to die at home, so I was able to be there with him and my mom as that happened. I was there with him as he took his last breath. And I cannot not mention the nurses that were around for him as well. So as you all know, that hospice nursing, you guys are all probably familiar with that anyway. The nurses were the ones that were there at 2:15 in the morning when he passed away on February 15th in 2014. They were the ones that came there. They were the ones that were at our side to provide us comfort and care. And also the nurses at the cancer center, the cancer center that I worked with, they were there for him all the time. And when he was inpatient at Mosaic, they were angels. They were there for him to relieve his pain and his nausea. They would just sit at his bedside and hold his hand and comfort him. They would go get him chocolate malts if he wanted one. And they were, most of all, the most important thing is they were compassionate. And I know you guys hear a lot about being compassionate and about being professional, and I can't say enough how the nurses that we encountered, they both had those characteristics. So without a doubt, the physicians were incredible to my dad and my family, and I will forever be grateful for them. But it was the nurses, and just in a few short semesters, that will be you guys that are there for those patients. And you will get to know the patients and their families, and you will forever hold a special place in their hearts, just like all of those nurses still do in mine. So thank you. I guess I will turn this over to Christy now.
Hi. I'm used to talking to you guys, but not all of you guys, so I'm a little bit nervous. So I'm Christy Campbell. I currently teach you guys pharmacology. Next semester I will have you for mental health. I always knew I wanted to be a nurse. I'm a family nurse practitioner and have been for 20 years. I always knew I wanted to be a nurse. My mom's a nurse. Our family's full of nurse practitioners, pharmacists. It really was never a question to me, but I kind of had a long route to nursing for knowing as a child that I wanted to be a nurse. I took a long way around it. I got to college. I was kind of interested in psychology, social work, and started taking some classes. I fully intended on getting a nursing degree. Before I knew it, 4 years was up and I had a degree in social work. And so my parents were like, what are you going to do now? So I talked about going back to nursing school. I thought about it at that time, but, and I knew I would go back to nursing school, but I was really interested in mental health. And so I had found out about a few programs at KU and MU, accelerated master's programs. And I thought, maybe I'll do that. So I did. I got into an accelerated program and finished my master's in a year, started working in an inpatient psychiatric unit, and I loved it, but it was very taxing. I mean, it really, it's hard work. It's very emotionally draining. I knew, like I said, at the same time, I always knew I was going to go back. It was just a matter of when was I going to do that. And it really didn't take very long to realize that I love this, but I'm a nurse. And so I went back to nursing school. And what I did is I became a nurse practitioner. So I'm a family nurse practitioner. I don't necessarily work mental health per se. I don't work in an inpatient psychiatric unit, and I haven't since the probably early to mid-90s. However, I do clinical with the mental health students. I stay current that way, but in family practice, I do a lot of mental health. You know, mental health is not just that person that you see that you think, oh, what's wrong with them? Something is wrong. Mental health is widespread. I don't know that anybody can say that a mental health issue has not touched your family. And, you know, what I find is that this was the most amazing, you know, combination for me to have the mental health experience and then to become a family nurse practitioner. I mean, I have, you know, I've been able to see generations of families, you know, 3 generations. Who gets to say that they've taken care of 3 generations of a family? You know, I'm very proud to say that, and I love it. I would have a tough time working in an area where I didn't get to continue seeing my patients. I mean, that's part of what I love, is that relationship that you get to build with your patients. And, you know, I know Dr. Harris had mentioned early on about holistic care. And I think that, you know, with my combination, that whole biopsychosocial, you know, you take into consideration, you know, everything. The whole person, not just the diagnosis, as you said. You take into consideration what other stressors do they have, what might they be feeling, how is this affecting their health. And I really think that, you know, taking the path that I have has really helped me to do that. I did go ahead and get my doctorate then. I kind of never intended on teaching. I kind of don't know how I got here, but I love it. So you know, I came, I thought, well, this will be a new thing. It's kind of neat. I like it. And then I've been here 15 years. So I do love it. And, but at the same time, I can't see ever giving up my family practice and my patients. That relationship to me, you know, is so important, and I just love that aspect of my job. As much as I love, you know, being able to, you know, help mold you guys, I love that. So, you know, the example, or the little story that I'm going to tell you is telling a little bit on myself, but I'll go ahead and tell it. But when I was 19, I was in a pretty bad car accident, and I had multiple injuries. I had a fractured pelvis and I had a broken leg. And so because of that, you know, I was in a wheelchair. I couldn't do physical therapy. I couldn't be weight bearing. And that was back, you know, a long time ago when you stayed in the hospital longer. So I ended up being in the hospital for 6 weeks. So to paint the picture for you, I loved college. I had a great time. I loved it. And all of a sudden, I am missing spring semester. I'm sitting in a hospital bed. I can't even get a magazine from, you know, the one side of my room because the wheelchair wouldn't go all over there, you know, all the way over there. So I was kind of limited to one small space. I had to ask for help for everything, and I do mean everything. And so, you know, it's very humbling. And, you know, at 19 years old, feeling like I'm missing out on a lot, I was not the most pleasant patient. I had, you know, they'd bring in breakfast at 6:30. PT would come in at 8. Are you kidding me? I was a college student. I stayed up late, and I did not get up early if I didn't have to. And so I wouldn't say I was necessarily the best patient. It took a special nurse to come in and to say, hey, what's going on? You know, you need to do PT, you need to eat, you need to be doing these things if you want to get better. And, you know, with her talking to me and recognizing that, you know, I wasn't just a jerk, I had these feelings behind that were driving my actions, and her taking that time to stop and realize that and sit down with me and talk about it and say, hey, how can we make this work? So, sorry, I'm nervous. You know, how can we make this work? And so we talked about it, and I said, you know, I don't eat breakfast, especially at 6:30 in the morning, and then PT comes at 8. I'm up half the night, I can't sleep, you know. And so, you know, we kind of, you know, and eating, you know, I had an NG tube, so, you know, try eating when you have a tube in your nose going down your stomach. It's not pleasant. And so, you know, we made a deal. And she said, you don't have to eat breakfast if you'll eat, you know, so much % of your lunch. because it's really important for your healing. And she explained everything. And so we kind of made a deal. And then she said, you know what, how about if we get PT to move you down later to like 10:30? And that worked out great. I mean, it was just those small things. Number one, her listening and recognizing the frustration of those little things that you may not think about, but just listening, just being there and thinking of, all of those other things that were going on. And I think that what I want you guys to know is I want you to be that nurse. I want you to be the nurse that doesn't say, oh my gosh, they're on their call light again, I don't want to go see them. I want you to be that nurse that thinks, I wonder what's going on. I wonder why they're pressing their call light a lot. I wonder if, they're upset about something. I wonder if something's going on they need to talk about. Or maybe the patient yells at you. I want you to be the nurse that doesn't take offense to that, because you know what? It's not about you. It's about them. And they're not yelling at you because you've done something or because you're not a good person. They're frustrated. They're taken out of their home. They might be scared. They might be worried, what am I going to do with my job? Who's taking care of my family? They have a lot of stresses. They have a lot of concerns. And sometimes, when we get stressed, we don't take it, we don't deal with it appropriately. And so, I want you to remember, it's all about the patient. It's not about you. Don't take it personally. It can be kind of hard. I want you to take that next step and just kind of look and see what's going on. Try to find some time, carve out and sit down with that patient that's grumpy and talk to them for 5 minutes. And once they realize that, oh wow, they're interested and they're involved and they care, they're a lot more likely to open up and let you know what's bugging them. And maybe it's something you can help them with. And maybe it's not. We have 2 ears and 1 mouth for a reason, and that's because listening is one of the most important things that we can do. So anyways, thank you. Thank you. And Stephanie Stewart's up next.
So you guys get to hear me all the time, don't you? I'll try to slow down so that they don't have to slow it down on the recording, right? So this morning, as we're all talking about, holy cow, what is going on with the weather, Heather texts me and says, by the way, our speaker just fell and hurt herself and can't be there. She can't walk. And I said, oh my. And I almost said, well, can we just bring her in a wheelchair? Because I have no backup plan. But I didn't, because that would not be a very nice thing to do. Instead, we said, well, what else can we do? And that's one of the things that I love about nurses, is that we all just kind of jump in together and say, okay, what can we do to solve this problem? And so we decided that we would each tell a little bit of a story about why we became nurses or why we did what we did. I've shared a lot with my students already, but one of the things that I haven't shared is why I became a nurse. So I originally, some of you know I was in the Marine Corps for 4 years, so when I come back from the Marine Corps, I originally wanted to be a doctor. So, and my husband always gives me a hard time because he says, I married you thinking you were going to be a doctor. Sorry about that. So I was actually pre-med here at Missouri Western, and was, I think, a couple of semesters in, was taking some pretty tough classes, and I got pregnant, which was totally fine. We were ready for that. We were ready to start a family. But at 13 weeks, I started bleeding, and go into the hospital to the emergency room, and they do an ultrasound, and of course there's no heartbeat there. And so, this was in the middle of the night, go to the doctor's office the next day, and well, this is what we're going to do, and this is how we're going to take care of this. And so was scheduled for surgery the next day, go in very, very early in the morning, and as we're getting on the elevator, I actually started bleeding and basically started going into labor at that point in time. So it was pretty traumatic, and I was pretty scared. And I remember hearing outside the curtain one of the physicians saying, why are we in such a hurry? What's the big deal here? And that really, really got to me. And then the next thing that I remember was a nurse standing beside me after we were done with everything. We're in the room, and that nurse was the one that really made everything okay. That nurse was the one who talked to me, who told me everything was going to be okay, who told me, I just needed to take some time. And so it was really during that healing process that I decided that, you know what, maybe it's not a doctor that I want to be. Maybe it's being a nurse that I want to do, because it was that nurse who made everything okay for me. It was that nurse that made one of the hardest times in my entire life be a little bit more palatable. And so it was at that time that I decided that I changed my major. I remember Mary Jo Gay used to teach OB. That was many, many years ago when I came here. And I remember for my final project in OB, we used to do little presentations, and I did a presentation to the OB nurses at Mosaic, at the time it was Heartland, and explained to them how very important it is that when a soon-to-be mother loses a baby, regardless of what time it is, whether they're 2 weeks along, whether they're 3 months along, whether they're 9 months along, when you lose a baby, all of your dreams are shattered. And so when I graduated, one of the things that I wanted to do was go into OB and help moms that had dealt with what I was dealing with. And so I did. I went into OB, went to a little bitty hospital in Falls City, Nebraska, and we saw maybe 5 OB patients a year. It was a very, very small, it was not that big. And so the students know I get very bored very easily. And so I got kind of bored, went to Shawnee Mission where we were, they do tons and tons of babies. And the goal was I was going to do labor and delivery, but a lot of times you get stuck in mother-baby, and I got really, really bored. So the students, I've told them that if you look at my resume, I have jumped all over the place, trying to look for that perfect place for me to land. And really, older adults is where I landed, where I spent most of my time. And then I got into teaching, and I absolutely love teaching like Christy. I don't think that anybody out here would want to do anything differently. It is really, really nice to be able to have the teaching side and then also have the practice side as well. So I find it very, very rewarding to do both. And I think, honestly, the most rewarding part of my career has actually been in my volunteer part. And the students have all heard about that so much that they're probably tired of hearing about that. But the reason I bring that up is that as a nurse, you can do so much good in your communities. You really can. And it doesn't have to be in your job. You can go outside of your job and really try to impact your community. And one of the things that I think I want you to get out of this program is the ability to connect with others and the ability to, as Christy said, treat everybody as an individual, treat everybody holistically, and find out what are their needs, what makes them tick, what can I do to help their life be as good as it possibly can. And so right now I spend a lot of time with people that have Parkinson's, and Parkinson's is one of those diseases where it's never going to go away. They're going to die with it, and sometimes they die because of it. And so my whole goal with those people is to give them the highest quality of life that they possibly can. And so every time that you interact with a patient, I hope you think about, what can I do to improve their quality of life? And let me tell you, you can do a lot. Okay? Do you want to come back up, or you just want us to do the symbols? We're going to do the symbols. So usually at this point in time, we hand it over to Dr. Harris, and she says thank you to the speakers, but I think we've spoken a lot. So we have 3 symbols that we talk about, and I will let Dr. Kendall and Dana come up here, and we talk about the 3 symbols that kind of have a lot to do with why we do white coat ceremony. Which one do you have?
The Arnold P. Gold Foundation and the American Association of Colleges of Nursing are sending a clear message to new nursing students that compassionate care must be a hallmark of your clinical practice. 3 symbols we will share today will serve as a visual reminder of your oath and commitment to providing high-quality care. The Arnold P. Gold Foundation's critical mission is to humanize healthcare, by advocating for compassionate care coupled with scientific evidence. Excellent, sorry. The goal is to prove healing and healthcare outcomes by restoring the balance between high tech and high touch, characterized by a respectful and compassionate relationship between nurses, as well as other members of the healthcare team and their patients. The Gold Foundation provided a lapel pin with its logo, a stethoscope in the shape of a heart, surrounded by the words humanism and excellence.
On one level, the white coat symbolizes the science of nursing and the commitment to providing quality, safe, compassionate, patient-centered care. But on another level, this white coat symbolizes a transformation that is about to happen to each and every nursing student.
And then the last symbol is the lamp, which the students will hold here in just a moment. Lo, in that house of misery, a lady with a lamp I see, pass through the glimmering gloom and flit from room to room. In 1857, Longfellow wrote about Florence Nightingale and her work that she did with the soldiers during the Crimean War. Florence became known as the Lady with the Lamp because of his poem. And because of her work, the lamp became a beacon of comfort and kindness and gentleness and courage, and an unswerving devotion to duty in the dark nights of hospitals. It is our hope as faculty that our students will also develop kindness, gentleness, courage, and that they will provide comfort to all those with whom they have contact. So at this point in time, we're going to get a little busy, and we're going to have the students line up along the wall. Tracy is going to help them, and then we'll have some faculty come up here on the stage, and we will actually coat the students. So as the students are lining up, for those of you in the audience, what we would ask is that you hold your applause until everything's all done, and then you can applause away. The students will then recite a pledge, and then we'll pretty much come to the conclusion of the ceremony. Once the students are all done, we are asking them to stay up here on the stage so that you can take pictures if you would like to take pictures. And it's always really fun to get very, very educated BS and nursing students all lined up alphabetically. Okay, so hopefully we are actually in alphabetical order. Okay, here we go. Christian Oschlager. Kaylin Anderson. Jessica Anderson. Brianna Barnett. Amy Beebe. Jordan Blue. Garrett Cassidy. Teresa Cobb. Alexandria Courtney. Brooke Crosser. Malia Cunningham. Isis Davis. Sierra Deskins. Ariel Dice. Brianna Erazo. Haley Evans. Jessica Fries. Shelby Gaines. Alyssa Gosson. Allie Grace. Marissa Grease. Jaylee Hamlin. Mary Hawkins. Kelsey Heckel. Jamie Heine. Madeline Hughes. Hannah Hummer. Lakota Johnson. Natalie Kovac. Jada Mogg. Haley McClure. Emily Mullins. Alyssa Nelson. Kelsey Oberhauser. Bailey Pickering. Holly Papa. Mackenzie Reddington. Madison Salmon. Caitlin Schmilly. Michelle Steinmetz. Michaela Sterling. Emily Speck. Roxanne Tobias. Kara Bang. Zuri Bang. Dakota Warner. Haley Williams. Katie Willis. Kayla Young. Tina Young. So I present to you the December class of 2020. So the last thing that we need to do is to have the students recite the pledge. There is a pledge in each one of your programs, so if you are a nurse, at this point in time, we would really like it if you would stand for us and recite the pledge with us. And we'll let Tina start with your class.
Okay. All right. So, as I begin my journey into professional nursing, I pledge to use the guidance, skills, and wisdom passed down by nursing professors and mentors to optimize the experiences and outcomes for patient-centered care. I pledge to use my eyes to observe, my mind to assess, and my hands to do no harm. I pledge to use my knowledge to provide holistic care, advocate for the patient, and to implement evidence-based practices. I pledge to collaborate and communicate effectively with the patient, the patient's family, and other healthcare professionals. I pledge to provide privacy, preserve dignity, and exhibit understanding to each patient by upholding professional, legal, and ethical standards of practice. I pledge to use compassion as a mechanism of healing, to treat every patient as an individual, and to always exhibit skillful practices to bring about health and wellness. With this pledge, I accept the accountabilities and responsibilities that the nursing profession embodies.
I have, so sorry, I have pants on. I just want to say the microphone. Is there more room? Yeah, put the microphone down. Push it. Really short. Go. Right here.
Before everyone leaves, I'd just like to thank you all. And as I was looking at you all, getting your picture taken, I couldn't help but think what amazing potential was on this stage. What amazing potential. And think about every single patient that you're going to care for in your whole life and the impact that you can make. So I'm really excited for you all. And thank you for coming, and thank you for taking the pledge. You have to read that every day so that you have it down. I've heard that before. Thank you all for coming this evening.